silent, deadly, invisible. These are the three words that best describe blocked arteries, the silent killers inside your body. What makes them so dangerous is that they often go unnoticed, quietly cutting off blood flow to your heart, brain, and limbs until it's too late. Right now, as you watch this video, your arteries could be slowly narrowing, setting the stage for a sudden heart attack or stroke. Here's the shocking truth. In the United States alone, someone dies from cardiovascular disease every 36 seconds. Yet, most of these deaths are preventable if the warning signs are recognized early. Unfortunately, too many people dismiss these signs as stress, aging, or simple fatigue. That shortness of breath, those leg cramps, that unexplained tiredness, they may not be normal at all. They could be urgent distress signals from your body. Today, we revealed 10 dangerous signs your arteries may be blocked. Number 1. Chest discomfort or angina. Chest discomfort, commonly called angina, is one of the most recognized but also the most misunderstood signs of blocked arteries. When people imagine a heart problem, they often picture dramatic chest-clutching pain like you see in movies. But in reality, angina usually feels far subtler, and that's why so many people miss it. Angina often shows up as pressure, tightness, squeezing, or a dull ache right in the center of your chest. Some describe it as if a heavy weight is sitting on them. The key detail is that this discomfort usually appears during activity like climbing stairs, walking briskly, or even during emotional stress, because that's when your heart demands more oxygen. But when arteries are narrowed by plaque, that oxygen supply simply can't keep up. What makes angina even more deceptive is that it doesn't always stay in the chest. Because your heart shares nerve pathways with other parts of the body, the pain may radiate to your left arm, neck, jaw, back, or upper abdomen. People often mistake it for muscle strain, dental problems, or even indigestion. But here's the truth. Each angina episode is your heart crying out for oxygen. Ignoring it is like ignoring a fire alarm. Research from the Mayo Clinic shows angina is frequently the first warning sign of coronary artery disease. Those who experience it face a much higher risk of heart attack if they don't take action. The pattern is often predictable. It comes with exertion, then fades with rest. That very predictability fools people into thinking it's harmless fatigue. If you ever feel recurring chest pressure or tightness that matches this exertion-rest cycle, don't dismiss it. Don't chalk it up to stress or spicy food. This is a medical emergency in disguise. Recognizing angina early and seeking medical evaluation can literally save your life. Number 2, shortness of breath. Shortness of breath might seem like a normal part of aging or being out of shape, but when it happens unexpectedly, it could be one of the earliest and most dangerous warnings of blocked arteries. Unlike the breathlessness you'd expect after running or climbing several flights of stairs, this type of shortness of breath sneaks up during everyday activities, walking across a room, carrying groceries, or even while resting. The science behind it is straightforward but alarming. When arteries narrow due to plaque buildup, your heart struggles to pump enough blood throughout your body. Imagine trying to water a garden with a kinked hose. The harder you pump, the less water reaches its destination. The same thing happens with oxygen in your body. Your muscles and organs crave oxygen, but the limited blood flow forces your body to compensate by making you breathe faster and harder. This symptom often develops gradually, making it easy to dismiss. You may notice that you get winded climbing one flight of stairs when just months ago it was effortless. Over time, it progresses, first affecting exercise, then simple walking, and eventually even basic daily tasks like getting dressed or having a conversation. For women, this symptom is especially significant. Research shows that women are more likely than men to experience shortness of breath as their primary heart disease symptom, while men typically report chest pain. This difference often delays diagnosis in women, making awareness even more critical. Mayo Clinic research also links unexplained breathlessness to early stages of heart failure, often caused by long-term arterial blockages. If left untreated, the heart weakens from overwork, and fluid can back up into the lungs, worsening the cycle of breathlessness. If you ever notice that you're struggling to catch your breath during routine activities, or worse, while resting, do not ignore it. This is your body's urgent signal that your heart and lungs are under stress, likely because your arteries are compromised. Early detection here could prevent catastrophic consequences later. Number 3. Dizziness, lightheadedness, or sudden nausea. Dizziness, lightheadedness, or sudden nausea may seem unrelated to your heart, but in reality, they're powerful warning signs of reduced blood flow to the brain and vital organs caused by blocked arteries. Dizziness occurs when your brain doesn't receive enough oxygen-rich blood, creating that unsettling, spinning, or unsteady sensation. Lightheadedness is often the result of reduced cardiac output. Your heart isn't pumping effectively because of narrowed coronary arteries. And sudden nausea? That happens when blood is redirected away from your digestive system to keep vital organs, like the heart and brain, alive. Research from UT Southwestern Medical Center highlights that these 3 symptoms often appear together during cardiac events. Many people mistakenly blame dehydration, stress, or even a stomach bug. But when dizziness, nausea, and lightheadedness occur simultaneously, especially alongside chest discomfort or shortness of breath, it may indicate a serious cardiac emergency. The danger lies in how easily these symptoms are dismissed. Think about it. Who hasn't felt dizzy or nauseated at some point? But when they strike suddenly and without clear explanation, they could signal a dangerous arterial blockage. Your circulatory system is designed to prioritize survival. When arteries become narrowed and your heart can't pump efficiently, blood pressure drops. Your brain is particularly sensitive to this reduction, which is why you feel dizzy or faint. At the same time, your digestive system gets shortchanged, leaving you nauseous. These aren't random annoyances, they are your body's emergency alarms. One of the most concerning patterns is when these symptoms appear during physical activity or emotional stress and then improve with rest. That pattern often means your heart is struggling to meet increased oxygen demands. If you ever experience sudden dizziness, lightheadedness, and nausea together, especially if they're accompanied by chest tightness or breathlessness, take it seriously. Do not wait to see if they just pass. This combination could be the start of a heart attack or another major cardiac event. Immediate medical attention could save your life. Number 4. Unexplained sweating, fatigue, or cold sweats. We all sweat. But there's a big difference between normal sweating from exercise or heat and the sudden, clammy, cold sweats that signal a serious cardiovascular problem. When your body is under extreme stress from blocked arteries, it activates emergency systems, releasing stress hormones like adrenaline. The result? Sudden, unexplained sweating, often accompanied by overwhelming fatigue. Fatigue here is not the ordinary tiredness after a long day. This is persistent, crushing exhaustion that doesn't improve with rest. Imagine waking up tired, struggling to get through your day, and feeling drained even without exertion. That's the type of fatigue linked to arterial blockages. Why? Because your heart is working overtime. With narrowed arteries restricting blood flow, your heart must pump harder and faster to compensate. Over time, this constant strain weakens the heart muscle, leaving your entire body starved of oxygen and energy. Cold sweats are particularly alarming. They happen when your body realizes vital organs aren't getting enough blood. Stress hormones kick in to keep you alive, causing sudden sweating that feels different from normal perspiration. Many heart attack survivors report that unexplained cold sweats were one of the first signs they noticed before their cardiac event. Research shows women are more likely than men to experience fatigue and cold sweats as their primary symptoms of heart disease, often without the classic chest pain. This difference is why women sometimes go undiagnosed until it's too late. What makes these symptoms so dangerous is their subtlety. Many people brush them off as stress, overwork, or lack of sleep. But if you find yourself exhausted for days or weeks without reason or breaking out in sudden, clammy sweats, you must pay attention. This isn't your body telling you to rest. It's your body warning you that your heart is struggling to supply enough oxygen. Ignoring these signals is like ignoring flashing red lights on your car's dashboard. They don't just go away. They get worse. And the consequences could be life-threatening. Number 5, pain that spreads beyond the chest. When most people think of heart problems, they imagine chest pain. But here's the truth. Cardiac pain doesn't always stay in the chest. In fact, one of the most dangerous warning signs of blocked arteries is pain that radiates to other parts of the body. This happens because the heart shares nerve pathways with several regions of the upper body. When your heart muscle isn't getting enough oxygen due to narrowed coronary arteries, the pain signals travel beyond the chest. The result? Discomfort in the shoulders, arms, back, neck, jaw, or even teeth. Mayo Clinic research shows left arm pain is strongly associated with heart issues, but it can occur in either or both arms. Jaw and neck pain often confuse patients and doctors alike because they're easily mistaken for dental issues or muscle strain. Even upper abdominal pain can be misleading, often brushed off as indigestion or acid reflux. The danger here is misdiagnosis. Too many people treat jaw pain with dental visits or abdominal pain with antacids, never realizing the underlying cause is their heart. Meanwhile, the arterial blockages continue to worsen, increasing the risk of a full-blown heart attack. The pain itself may not even feel sharp. Many describe it as heaviness, aching, pressure, or discomfort. And, just like angina, it often follows a pattern, appearing during activity or stress, then easing with rest. This cycle is a red flag that the pain is cardiac in nature, not muscular or digestive. Think of this as your body's way of misdirecting the warning. The source is your heart, but the signals show up in other places. That's why you must be alert. If you notice recurring pain in your arm, jaw, back, or stomach that comes with exertion and disappears with rest, treat it as a possible heart issue until proven otherwise. It's better to have a doctor rule out heart disease than to ignore the signs and face a medical emergency later. Remember, when pain radiates beyond the chest, your body may be warning you that your arteries are dangerously blocked. Number 6, leg pain or cramping. When walking, one of the most overlooked but very telling signs of blocked arteries is leg pain or cramping that occurs during walking. The medical term for this is intermittent claudication, and it's a classic symptom of peripheral artery disease, PAD. Here's how it works. When you're at rest, your narrowed leg arteries can usually supply enough blood. But when you walk, climb stairs, or exercise, your leg muscles demand more oxygen. Because of arterial blockages, the blood supply can't keep up, and your muscles essentially suffocate. The result is cramping, aching, or fatigue, most often in the calves, but sometimes in the thighs, hips, or buttocks. The pattern is predictable. The pain appears after walking a certain distance, then eases with rest. As blockages worsen, the distance you can walk without pain gets shorter and shorter. At advanced stages, the pain may even appear while resting. PAD is not just a leg problem. Cleveland Clinic experts stress that if you have blocked arteries in your legs, there's a very high chance you also have blockages in your heart or brain. This means leg pain can be a red flag for an even bigger cardiovascular crisis waiting to happen. Worldwide, Pennsylvania D affects over 200 million people, and in the U.S. alone, more than 12 million adults over 40 suffer from it, many without knowing. That cramp you dismiss as just getting old could actually be your arteries begging for attention. What makes intermittent claudication dangerous is its tendency to masquerade as something else. People often think it's muscle strain, poor fitness, or even arthritis. But unlike those conditions, Pennsylvania D pain follows a very specific pattern activity, triggers it, rest relieves it. If you notice this recurring symptom, don't ignore it. It's not just about saving your ability to walk comfortably. It could be a sign that your entire arterial system is compromised, and without medical attention, the consequences could be far more serious than sore legs. Number 7. Non-healing sores, coldness, or color changes in feet and legs. Your feet and legs can reveal powerful clues about your arterial health. Non-healing sores, persistent coldness, or sudden changes in skin color are all signs of advanced peripheral artery disease, where blood flow is so restricted that tissues can no longer function normally. Think about this. Your skin, muscles, and even hair follicles all rely on oxygen-rich blood to stay healthy. When arteries are blocked, that supply is cut off. Wounds that should heal in days or weeks linger for months. Small ulcers or cuts become stubborn sores that resist treatment because your arteries can't deliver enough oxygen and nutrients to repair the tissue. Coldness is another red flag. If one foot or leg consistently feels colder than the other, that indicates significant blockage in the arteries feeding that limb. Blood is what maintains warmth, and without enough flow, extremities grow noticeably cooler even in warm environments. Skin color changes add another visible warning. Pale, bluish, shiny, or patchy skin can indicate uneven circulation. Sometimes the skin looks thin and hairless because hair follicles die off without adequate blood flow. In severe cases, the skin may take on a mottled appearance, showing just how compromised circulation has become. The Cleveland Clinic warns that these visible signs mean arterial disease has progressed to a dangerous stage. At this point, not only is your mobility threatened, but your risk of heart attack or stroke is significantly higher. Too often, people mistake these symptoms for minor issues like poor footwear, diabetes-related changes, or simple aging. But the truth is, circulation should keep both legs equally warm, pink, and healthy. When one limb feels colder or looks discolored compared to the other, it's a serious warning that blood flow is being choked off. Don't wait until a non-healing sore becomes infected or gangrene sets in. These external clues are your body's desperate cry for help. Recognize them early, and you can still reverse the damage and protect your overall cardiovascular health. Number 8. Erectile dysfunction in men. Erectile dysfunction, or ED, is often thought of as a private or purely psychological issue. But in reality, it can be one of the earliest and most powerful predictors of blocked arteries. Here's why. Erections depend entirely on healthy blood flow. The penile arteries are much smaller than the arteries supplying the heart or brain. Because of their size, they're often the first to show signs of plaque buildup. This means ED can appear years before a man develops chest pain, shortness of breath, or other obvious heart disease symptoms. Research from the Physicians Committee for Responsible Medicine shows that men with erectile dysfunction have a significantly higher risk of heart attacks, strokes, and peripheral artery disease. In fact, ED can be an early warning system for cardiovascular disease across the entire body. The timing makes it especially valuable for prevention. If arterial blockages are caught when ED first appears, there may still be time to reverse or slow the disease before it causes a life-threatening event. Unfortunately, many men attribute erectile problems to stress, aging, or relationship issues, and never consider a cardiovascular cause. Doctors emphasize that ED without a clear psychological trigger should always raise concern about artery health. Particularly in men over 40, unexplained ED is a red flag for underlying vascular disease. The arteries that feed the penis are telling you something. If plaque is clogging them, it's almost certainly building up elsewhere too, in your heart, your brain, or your legs. This connection demonstrates just how interconnected the circulatory system really island problems in one part of the body often reflect systemic problems everywhere. That's why treating ED with quick fixes alone misses the bigger picture. The real solution lies in identifying and addressing arterial blockages. So if you or someone you know is struggling with erectile dysfunction, don't treat it as just a bedroom issue. It could be your body's way of giving you an early warning, and acting on it could prevent a far more serious outcome later. Number 9. Transient ischemic attack. Imagine experiencing sudden numbness in your face, weakness in your arm, or slurred speech, only to have the symptoms disappear within minutes or hours. That's a transient ischemic attack, thanks in advance, often called a mini-stroke. And while it may resolve quickly, it's a major red flag for blocked arteries. A thanks in advance happens when blood flow to part of the brain is temporarily interrupted, usually because of plaque buildup or a clot in the carotid arteries of the neck. The symptoms mirror those of a stroke: facial drooping, weakness on one side of the body, difficulty speaking or understanding speech, and sudden vision problems like blurriness or partial blindness. The difference is that TIAs don't cause permanent damage, but that doesn't make them safe. In fact, 1/3 of people who experience a thanks in advance will go on to have a full-blown stroke within months if the underlying problem isn't treated. This is why UT Southwestern Medical Center stresses that every thanks in advance should be treated as a medical emergency. Even if the symptoms vanish, the arteries supplying your brain are already dangerously compromised. Ignoring this warning is like ignoring the first crack in a dam before it breaks. TIAs often fool people because of their temporary nature. You may think, I feel fine now, so it must not have been serious. But the reality is, the temporary blockage means your brain narrowly escaped disaster. Next time, the outcome might not be reversible. Key signs to watch: sudden numbness or weakness on one side of the body, facial asymmetry, trouble speaking, difficulty understanding others, or sudden vision loss. Even if these symptoms last only a few minutes, they demand immediate medical attention. A thanks in advance is your brain's distress signal, warning that a major stroke is likely around the corner. Don't wait for that disaster to happen. Early recognition and treatment can prevent a lifetime of disability or save your life altogether. Number 10. Acute limb ischemia. The final and most severe warning sign of blocked arteries is acute limb ischemia. a sudden, complete blockage of blood flow to an arm or leg. Doctors often remember this condition by the 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia. It starts with severe, constant pain that doesn't improve with rest. Unlike intermittent claudication, which eases when you stop walking, this pain is relentless and often feels like burning deep inside the limb. As circulation stops, the limb becomes pale or waxy compared to the other side. Next, pulselessness sets in. Doctors won't be able to feel a pulse below the blockage. Paresthesia, or tingling and numbness, follows as nerves are deprived of oxygen. If untreated, this progresses to paralysis, meaning the muscles can no longer function. Finally, poikilothermia occurs. The limb becomes cold to the touch, unable to maintain its temperature. This is a true medical emergency. Without immediate intervention, tissue death begins within hours, often leading to permanent disability, limb amputation, or even death. The tragedy is that many people delay seeking help, mistaking the pain for muscle strain or nerve problems. Acute limb ischemia doesn't happen out of nowhere. It usually reflects advanced arterial disease throughout the body. If your leg arteries are blocked enough to cause sudden ischemia, there's a high chance your heart and brain arteries are also at risk. The 6 Ps are not just a checklist, they're a countdown. Each one signals that time is running out for your limb and possibly your life. If you ever experience sudden, severe leg or arm pain with coldness, numbness, or loss of function, do not wait. Call emergency services immediately. Remember, blocked arteries are systemic. A problem in your limb is often a mirror of what's happening in your heart or brain. Recognizing acute limb ischemia early can mean the difference between recovery and irreversible damage. Blocked arteries are silent killers, but they are not unstoppable. Your body is constantly giving you warning signs: chest discomfort, shortness of breath, dizziness, unexplained fatigue, pain spreading beyond the chest, leg cramping, non-healing sores, erectile dysfunction, stroke-like symptoms, and the 6 Ps of acute limb ischemia. Each one is a signal that your circulatory system is in danger. The key is recognition and immediate action. Don't ignore these red flags or chalk them up to stress, aging, or normal tiredness. Your life may depend on catching them early. If you or a loved one notice these symptoms, seek medical care right away. And if you found this video helpful, share it, subscribe, and help spread life-saving awareness about cardiovascular health.